Direction of movement. The direction we choose when moving directly influences the result and the quality of the line. You can move away from yourself, toward yourself, vertically and horizontally. In all cases, the results will be completely different since the working angle of the handpiece is different. Let's look at the direction of movements. We should use a different angle with different directions of movements. Please pay attention to these pictures. When moving from left to right or from right to left, the handpiece should always be in line with the line that you are drawing. If you move from up to down, the handpiece should be also in line with the line you are drawing. Please remember that at a certain angle, the handpiece is suitable only for a certain direction of movement. Please pay attention to what is demonstrated in this video. When we use different angles of the handpiece, we get different results. To get the most elegant thin line, we need to hold the handpiece at 90 degrees, which is perpendicular to the surface of the skin. With the movement from up to down, the angle is 90 degrees, which is the right angle. With movement from right to left or left to right, the angle has changed. Now it is 60 degrees, and this is also right angle for this movement. And now, the wrong execution. If we perform movements from left to right and from right to left using an angle of 90 degrees, we'll go very deep into the skin. What's more, if we perform movements from top to bottom using an angle of 60 degrees, the pigment is inserted in a completely different direction, which then forms micromigration. This slide shows two directions when working with a needle toward yourself and away from yourself. When we work with the needle away from ourselves, there are essentially no problems. The only danger is if the angle of the handpiece is 45 or 60 degrees, there is a risk of injury. Let's call this the scalpel effect. When we work with the needle towards ourselves, the skin has stronger resistance. We lose speed and the needle goes to unequal depth. Pigment at different depths will heal in different ways. When moving the needle towards ourselves, there is a high risk to going very deep and leaving dark spots or going too shallow. Pay attention to this picture also. The movement of the needle toward yourself is prohibited when using an angle less than 60 degrees. You feel the resistance of the skin even when you tighten the skin strongly. So how can you get out of this situation? The best solution is to move the needle toward yourself and change the angle of the handpiece to about 80 degrees. Thus, the resistance of the needle from the skin will be less and will allow you to move more steadily and apply the pigment more evenly. This next example is very interesting. In my opinion, it characterizes and reflects stretching very well and shows how it affects the work area. For example, if the stretching is done correctly, the needle does not cling to the skin and we move slowly and smoothly in both directions, away from ourselves and toward ourselves. When we move the needle toward ourselves, there are no wrinkles in front of the needle and it becomes easy to be moved. However, as you can see, if there is no pressure, the skin creates wrinkles, which impedes the work. This example is shown on a glove, where you can see micro wrinkles that will be formed when working with the needle toward yourself. When you work with the needle away from yourself, there are no problems or difficulties. The problems occur when we direct the needle towards ourselves. Please remember that pigment at different depths will heal differently. When moving the needle toward yourself, there is a risk of inserting the needle too deeply or not deep enough, and it will be visible after the healing. That's why every time you make a movement with the needle toward yourself, remember that the handpiece should be raised and the angle should be 80 degrees.